Take your time, doctor.
Well, good job, Ralph. All done under 1 minute. Do you normally exercise like this?
No.
Well, I think running upstairs is a good form of exercise, and if you can do that about 7 minutes a day, you probably will be able to benefit yourself in the long run.
That's great.
Yeah, I think if you're going to do some exercise planning, maybe we should go into my clinic and then we can talk more.
Yeah.
That's very good.
Many of us start an exercise regime without giving much thought. We head out to buy a pair of running shoes or a tennis racket, call a few friends, and hey, we start an exercise regime. What if we haven't exercised in a while or have a medical condition? What precautions do we need to take? Let's talk to Dr. Jeremy Chow, cardiologist at Gleneagles Hospital, to find out more. Hello, Dr. Chow.
Hi, Ralph.
Tell me, what do I need to do before starting any exercise regime?
Well, that's a very good question, Ralph. Well, I will usually recommend that anyone who wants to start on an exercise program, especially if they are around the age of 40 years old and it's the very first time that they're going to embark on a very intensive training, they should go and see their doctor to do a very simple basic evaluation to see whether you are fit or not fit to participate in sports, especially if you're thinking of competitive sports. Usually at the clinic, what we will do is we will take a quick interview and find out more about the patient, more about yourself, more about your family history and any other pertaining risk factors. And importantly, we will do a physical examination to make sure that physically you are well and there are no contraindications for you to embark on any exercise program. But I think today we will not be able to just tell you to go ahead and do your exercise without doing some basic investigations. So in our clinic, we generally will do some non-invasive tests to re-stratify you to see whether or not you are at any risk of sudden cardiac event. And this test will include a simple baseline ECG to look at your heart rhythm, an ultrasound scan of the heart, which is called 2D echocardiography. And then since you're going to exercise, why not let's start off with a treadmill in the clinic. And we will do a treadmill to make sure that everything is fine when you exercise. So with all that done and concluded, and if you are normal and is well, then I think there's no major risk for you to participate in any exercise program. Hi Ralph, so this is the very first test that we are doing, and this is called 12D ECG. Here what we do is that we put you on some electrodes, and on the electrodes you'll be able to get your heart tracing. So this is the heart tracing for you today, and your heart tracing looks very good. So there's nothing wrong here that will disadvantage you for any exercise regime. And I think following this, we're going to do the ultrasound of the heart or the 2D echo. Well, Ralph, right now looking at the images of your heart scan, everything looks good. Your heart muscle is of normal thickness, there is no scarring, and the contraction is very good. Your heart function is very normal. So it looks like your heart is good to go, and there's nothing that we can see here that will cause any sudden cardiac event. So I think let's move on and do a little bit of exercise in the clinic, shall we? Okay, Ralph, this is the last part of the screening, and this is what we term as pre-participation screening. This is called the exercise treadmill. So during the exercise treadmill, we'll be looking out for any ECG changes that will be suggestive of any underlying artery blockages which you're unaware of, or any form of abnormal heart rhythms that can predispose you to sudden cardiac event. During this exercise, we'll be monitoring your blood pressure and monitoring your heart rate, and let you slowly do a graduated exercise stress. So if you're ready, we will start the treadmill and we'll get you to do a little bit of exercise. You're good to go? Yeah. Alright, so I'm going to start the treadmill and then you can start by walking.
That was fun. Try the challenge out for yourself and share the result with us on Instagram at #topofyourgame.
Remember, if you are thinking of starting an exercise program, it is advisable for you to speak to your doctor to see if pre-participation screening is needed. If you have already started, it is still not too late for you to discuss this with your doctor and see if you need pre-participation screening, especially if you're above 40 years old. Remember, health matters and you should always exercise safely.
Until then, stay tuned for more health and medical tips and information on the Gleneagles Study Day Challenge right here. www.gleneagles.com.sg/WTA. See you then!